everyone, my name is Adia Garcia from Trust Surgery Consultants. Today we are here at the beautiful new office of Dr. Mathew Plant, one of Canada's leading plastic surgeons. This is a very special moment for us because we are going to be launching a new educational series where we highlight the best surgeons and how they approach plastic surgery and postoperative care. So Dr. Plant, we have a couple questions for you. We want to get to know you and how you approach plastic surgery, how you approach postoperative care, which is what we specialize in. Let's start with what inspired you to pursue plastic surgery and how you still remain engaged and loving what you do.
That's a good question. I think ultimately what got me into plastic surgery was when I got my head split open skiing and waited like 3 hours for the plastic surgeon to come sew my face up because my mother would not let anybody else do it. And if we're waiting 3 hours for this guy, must be something special. And then I kind of looked into what it was and was like, oh, it's scientific and artistic. Yeah, this kind of seems like it fits my interests and skills, and that's just sort of how it started, and never even thought of anything else.
Amazing. So what do you believe distinguishes a great plastic surgeon beyond technical skill? What makes a good plastic surgeon?
This might be controversial, but honestly, never thinking the results are good enough and always trying to do better next time.
Overachieving, essentially, right?
I think so, yeah.
And remaining always educated, because I feel like the industry is always evolving, especially plastic surgery. There's always a new technique, new way of doing it, so staying engaged, right?
Yeah, and I think perfectionism and obsessive compulsive, basically just up to the line before you would be committed to a mental institution.
Basically just borderline insanity.
Yeah.
That's good. Okay, so in your experience, how critical is postoperative care to achieving optimal post-surgery results? Because I know this is also newer. Most surgeons in Canada, I feel like, don't believe in postoperative care, or they think it's not necessary. I think it's more that they don't trust who they send their clients to. That's a big thing, right? So what's your take on that?
Yeah, so most of our training, it doesn't really... They don't train people too much in aesthetic surgery because, those teaching view those learning as potential competition down the road. So there isn't much conversation about post-op care when it comes to aesthetic surgery. And there's no question other countries, the further towards the equator you go, the more they are this is everything as much as the surgery is. And it's just the surgery is the surgery and that's it. Some people don't even give instructions for self-massage after.
It's true.
And because there's not really much in the way of regulations, it's tough to know who knows what they're doing and who doesn't. I've had patients come back and tell me these horror stories from post-op care specialists that, it sounded like, they were information extractors from the CIA, the way that these experiences went. And I would rather my patients have nothing than have bad post-op care. So until I've sort of gotten some feedback, on yourself and a very select handful of people who seem to know what they're doing, I've just been let's not risk anything.
Yeah.
If you're going to go get post-op care, these are my restrictions. If you've done a BBL, nobody touches your butt for 6 weeks. But now, as we're more collaborative, there's definitely more value in it for certain things. And it just takes time to sort of see the evidence firsthand because there just isn't much in the literature.
There's nothing really.
Yeah.
It's an unregulated industry.
Exactly.
Anybody can do it, unfortunately. But I think it really does come down to trust.
Yeah.
It's funny, that's the name of my business, but trusting who you send your client to is huge, right? And then coming back and saying, I had great service there, but also it shows in their body how they healed, right?
Yeah,
I think it's huge.
Absolutely.
Yeah. Okay, so next, what are the most common challenges patients face in recovery, and how do you help prepare them for those challenges?
I always make recovery sound worse than it's going to be.
Good, because a lot of surgeons dumb it down. No. And I love when surgeons tell clients, you're going to be down for 6 weeks, or you're going to be down, it's going to hurt, you're going to be in pain, etc.
Yeah. So I would rather over prepare as well. Hopefully everyone comes back and says like, it was not nearly as bad as you said it would be. But I guarantee every single one of my tummy tuck patients, they absolutely hate me for 2 weeks. They will be at home cursing my name. And if they're not, I didn't do my job right.
Yeah.
By 6 weeks, they love me again.
Well, they love your belly buttons because that's what everybody tells me. He's the belly button guy.
You think they need you? Imagine if they need us.
Yeah.
True.
Okay.
You guys are actively torturing them during that
Yeah,
period, but it is for their own good. So I think that's really kind of how I like to manage it. We also give a lot in the way of information packages. So when someone books a surgery, they get a confirmation email, which includes, what to expect from surgery in general, like before, during, and after. And then whatever procedures they're doing, they get additional packages. Like, this is what you can expect from liposuction. This is what you can expect from breast augmentation.
Perfect.
This is what I want you to do leading up to surgery. This is what I want you to do the day after surgery. This is what I want you to do 6 weeks after surgery.
Right.
So we put it in writing so that they can, refer to it. We give them a copy when they leave from surgery. They have it emailed initially. If they ask again, like, we'll send another. And then it's there. You wake up at 2 a.m, like, oh my God, did I forget my medication? What was I supposed to do? It's right there.
Perfect. I love that. I love a well-prepared surgeon.
Yeah.
Because a lot of the times clients come to us with, we get clients from overseas, we get clients from Toronto, from everywhere, but I feel like some clients have to rely on going on Real Self or on Google and I love when a surgeon prepares them because then they come to us and they're not blindsided with recovery. They know what to do, which is great.
And you can't really go on like Real Self or anywhere else to figure out what to do post-op for your surgeon.
Right.
You can only figure out for that surgeon who probably does the surgery differently.
Right.
You got to give people their own post-op protocol.
Exactly. Okay, let's see. How do you see the role of partnerships with post-op specialists like us improving your patients' outcomes?
I think it's critical. You and I have communicated over a few patients, and I think that having that direct line of communication is important. I've done it where I've told the patient, like, tell so-and-so, like, this is what I would like them to do.
Yeah.
The direct line of communication is much better.
Yeah, I agree. This might be overkill. What does the ideal collaborative recovery plan between surgeon and post-op team look like to you? Kind of covered that right now, but ideally, what would you want from us to help the betterment of your clients? Because we're seeing them a lot more than you, right? You're seeing them at their checkups. We're seeing them probably sometimes 10 to 20 times.
Yeah.
We're walking them through not only just the actual recovery of their body, but a lot of it is mental. A lot of it is emotional. So is there anything that we could do better to serve your clients?
Things are pretty smooth now, but I think, over time it would be good if we could kind of formalize some protocols. So on our end, we tell a patient, all right, you're going to go day 2. This is what you can expect to happen. This is what will happen the following week. Get this many massages, get these treatments done, and, just make it very straightforward. I like to make surgery easy for patients. We handle absolutely everything. And, I put on waterproof dressing so they don't even have to think about I got a sponge bathe or something. Yeah. So if we just make it super smooth where it's all right, you're going to go to trust on day 2. They're going to do this. Yes. You're going to come see me week 1, week 6, whatever. And it's just seamless. Totally they don't know they're in a different clinic, except they're in physically different spaces.
Exactly. No, I agree with that. If they know before their surgery that they have their 10, 20 massages already prepared, I think clients' stress level goes down. Mm-hmm. They feel taken care of, and I feel like understanding that the message is the same from us and you is key because there's so much misinformation out there.
Absolutely.
So I think if we create a seamless transition, it'll be good. 2 more questions.
Sure.
Okay. What advice would you give someone planning surgery for the first time to ensure they get the best possible results? I feel like pre-op is huge. Preparing their body for surgery.
Yeah,
huge.
The consultation process is the key. finding the right surgeon for you.
Mhm.
And I don't, I'm not one of those guys that's like, well, I'm the right surgeon for everybody. Obviously, like the only way you can have good surgery is come to Dr. Plant. It's all about the right fit. Find a surgeon who does what you're looking for, who
Yes.
has an aesthetic that you're like, that is what you want, or is able to give you what you want. And like, see how the consultation process goes. How do you feel you click with that person? Like, if stuff goes sideways, are they going to be there to take care of you? Complications are a numbers game. It's not a skill game. So any surgeon who's been operating long enough is going to have complications. So how are they going to manage that? How do you feel they're going to manage it? Is this someone who is so worried about protecting their own ego that if you have a complication, they're going to be like, I don't want to see you. Like, bye. Like, I cannot put up with the fact that something has gone wrong. Or are they going to be like, I want to see every single clinic day to make sure
Yes.
you're doing well, you're coming along. If something is going the wrong way, we're going to look after it. So I think that's the foundation. And then realistically, the surgeon you choose should prepare you. Like, you shouldn't have to go out and find this pre-op information.
Yeah.
It should be given to you, and you just follow it.
I agree. Okay, last question. Why do you believe education and proactive aftercare are just as important as the procedure itself?
I mean, knowledge is power. So if you teach a patient why they're supposed to do something, I think they're a lot more likely to do it. And it's the same with the post-op care. These are the things I think you should do. This is why I think you should do them. It's why it's worth spending the extra money to go and get this done. These are the things that I don't think you should do. These are the things that, you might see on the internet. Someone's going to try and sell you. And I think that they're a complete waste of money. Don't
do it. At least you're honest.
Absolutely.
Absolutely. I'm the same way. If I can be honest with clients and, that shows integrity is huge. If no different than if you don't do a specific surgery, let's say, for example, something controversial like rib remodeling right now is pretty big.
Oh,
you don't do it, you're going to say, listen, I don't do it, but this is who does, or this is why I think you shouldn't, or this is why your body wouldn't necessarily benefit from it or whatever, right?
Exactly.
Yeah. Okay, last question because I'm curious.
Sure.
What do you specialize in? What would you say is like your top surgery that you love to do and you feel like it's your specialty?
Yeah. I could do a top 3, but I don't think I could do a top 1.
Okay, that's the top 3.
Well, I guess breast revision that's what I really love.
Really?
I think because it is so damn frustrating. It's possibly the hardest thing in plastic surgery, like taking really, really poor outcome breasts, shall we say,
Yes.
and try to make them look good. It's different every single time, and
It's complex.
very complex. But tummy tucks and like Brazilian butt lifts and body contouring really close second, because same thing, like you can fuss endlessly. Like I can spend an hour on a belly button in the operating room
Right.
easily. Same thing trying to get perfect smooth curves
Symmetry.
to the hips and blend that. Like there's just so much out there that's like slightly off to like want to be able to do it so it looks completely natural.
Professionalism too, right?
It is, and like the goal is that like nobody ever leaves my office and anyone can tell they had plastic surgery, but everybody is like, how the hell is that person so lucky?
Mhm.
Who gets born with a body like that?
Very good. And what would you say is a surgery you would never do? There's so much
Oh my god.
right now.
Yeah. I mean, at the moment, that rib remodeling stuff you mentioned is something that I would not touch, but that may change.
Right.
Because technically speaking, it's very easy. It's
It's just a grade-stick fracture, right? It's just very, very simple.
by numbers game, again, how many ribs are you going to put a drill into before you end up in someone's lung?
Right.
Not a skill thing.
Right.
That's definitely on there. Fracturing pelvises to make hips look more feminine, probably not something I'll ever do.
What about gluteal implants? What do you think of those? Yeah. It's so hard to find surgeons that do it.
For a reason.
Yeah. High complication rate.
Very high complication rate. And if I'm being honest, I'm yet to see butt implants that actually looked like a butt.
Yeah.
They always look like, it's a weird way to describe it. It almost looks like nibbles on the butt because it's never the right size. You have this like protruding circle in the middle
Yes.
of the butt, and it
Yes.
just looks weird.
They don't age well either. I mean,
No.
I feel like table, they look good. Immediately, they look pretty good. And then later on, they shift and yeah.
Yeah, I take a ton of them out, but I don't
Do
put
you?
them in.
I have them and I have to actually replace mine. So
Oh.
I have to go to Columbia to do them. But,
They just know what they're
topic.
doing there with them.
They do. Yeah, they do. But it's hard to find surgeons that do it here. So, I mean, I don't think anybody really does it here, to be honest.
Not well.
Yeah, not well. It's different down there. I mean, not to say that the surgeons are different here than there. It's just, I find their approach to surgery down there is a little bit different, and the approach to postoperative care is completely different.
Yeah, like, oh, you trained in that during residency. Whereas here we don't, and Health Canada doesn't actually allow that.
That's the other
And
thing.
that's the reason.
Yeah,
So when it's special access, it's tough to get.
yeah.
Yeah, I think like 2 people do it.
Yeah, I think that there's only one. I think it's because he treats trans clients, and there's that loophole there. So and
Still has
it's
to have
another
special
subspecialty,
access,
right? Yeah.
Yeah.
All right. Question.
Yes.
How do you keep up to date with certain trends going on in the plastic surgery industry? Like all the new type of surgeries coming out, new ways to approach them.
Conferences.
Yeah, so I mean, I go to certain conferences where I know they're going to talk about stuff that's cutting edge. But other than that, I really try not to actually, because then you end up too far on the edge. If something is going to be sticking around, it will make its way to my radar, and I'll get more information on it.
Because
Like it'll show up in my feed or something.
Yeah, exactly.
Yeah, but I don't want to be right at the leading edge there, because that's how you end up, being the person who did all of these horrible things that we now look back at. It's like, what were they thinking?
Mm-hmm. Mm-hmm. Do you feel like a surgeon should specialize in body or face? Or do you feel like a surgeon can do both? I find facial surgeons, it's a little bit different. It's a little bit more meticulous.
It's definitely a different animal,
It
for
is,
sure. Different
yeah.
anatomy. I think that plastic surgeons can absolutely do face and body. I think, if you want to be like truly excellent at any one thing, you need to do a ton of that. Like, I don't think that I could be what I am for like breast revision and then also be like the revision deep plane facelift guy, because it's such commitment to both. But also keep in mind, like, facial plastic surgeons aren't allowed to touch bodies, so
They're not?
that's why they focus on face.
Oh, I didn't know that.
Yeah, they're ENT surgeons, so unless they get like special permission from the Royal College, they can only operate on faces.
Huh. I learned something new. Awesome. Do you have any questions for me?
Off the top of my head, no.
Okay, good, because I didn't want to be put on the spot anyway. Well, this was about you, and I'm so glad that you let us come. I hope this is the first of many interviews and collaborative protocols and the betterment of good care for your clients.
I'm gonna have to come check out your place now.
Well, definitely. Or my place is pink, so it's a girl's place. But a lot of the clients that you send us are women. Do you see male clients?
Yeah, we treat men.
Okay.
They're much less likely
Oh, for sure.
to do post-op stuff.
Men are scared of treatments.
Okay.
Straight men.
And pain. Actually, that's true. Straight men.
Yeah.
And we need to target the other.
Yeah, understand.
Yeah. For the most part, my gay patients have no problem going.
No, they love to know that
They're
stuff.
actively seeking it out. Very proactive.
Good.
Yeah.
Well, hopefully we'll see a lot of those soon.
Yeah.
It was very, very nice interviewing you, and stay tuned for more.